Today, I want to talk to you about something most men don't realize until it becomes a real problem: the size of the prostate. As the years go by, this gland begins to grow, a condition known as benign prostatic hyperplasia. It's not cancer, but it's a condition that brings uncomfortable consequences, like getting up several times at night to urinate, feeling like the bladder never completely empties, having a weak urine stream, feeling a sudden urge to go at inconvenient moments, and in some cases, even affecting intimate life. What almost no one knows is that there is a specific exercise that, when done consistently, can help reduce the inflammation and size of the prostate in just a few days. I'm not talking about medication or surgery. I'm talking about something your own body can do when you learn to activate the right muscles and improve circulation in the pelvic area. Let me explain step by step why this exercise is so powerful, how to do it correctly, and what to expect if you start incorporating it into your daily routine. The prostate is a walnut-sized gland located just below the bladder and wrapped around the urethra, the tube that carries urine out of the body. Its main function is to produce part of the seminal fluid that transports sperm. With aging and hormonal changes, this gland naturally begins to enlarge. The problem arises when that growth becomes excessive because being so close to the urethra, it compresses it and makes urination difficult, like squeezing a hose while the water is running. That pressure forces the bladder to work harder, which causes irritation, weakness, and, over time, very uncomfortable symptoms. When the prostate is inflamed, urination is not the only thing affected. Sleep quality declines too, as men often wake several times during the night. There's tension in the lower abdomen, and sexual desire and performance can also decrease. That's why any strategy that can reduce inflammation quickly feels like a major relief. Most men don't know that prostate health doesn't depend solely on medication or diet. There's a silent but crucial factor: circulation in the pelvic area and the condition of the pelvic floor muscles. When we spend long hours sitting, are overweight, or don't perform specific lower body exercises, blood doesn't flow properly to the prostate. This lack of oxygenation and drainage causes congestion, inflammation, and discomfort. This is where the exercise I want to share with you comes in. It's a simple practice you can do anywhere. It requires no expensive equipment, and when done several times a day, it can help deflate the prostate, strengthen the pelvic floor, and make urination smoother. The key exercise is the Kegel exercise for men. You've probably heard of Kegels in women, especially during or after pregnancy. What few people know is that in men, these exercises are just as powerful, particularly for the prostate. Kegel exercises involve contracting and relaxing the pelvic floor muscles that surround the base of the bladder, urethra, and prostate. By working these muscles regularly, blood circulation improves, fluid drainage increases, and prostate congestion decreases. Strengthening these muscles helps control urination, increases urine flow pressure, and improves sexual function, since these muscles are also involved in erection and ejaculation. To do this exercise correctly, you first need to identify the right muscles. The easiest way is to stop your urine flow midstream. The group of muscles you use to do that is the one you should train, but do it dry, not while urinating. Once you've identified them, contract the muscles as if you were trying to stop urination, hold the contraction for a few seconds, and then relax. Repeat several times in a row. What matters most isn't just tightening, but also relaxing, because the balance between contraction and release is what boosts circulation. Do several sets throughout the day. Start with a few repetitions, and as days pass, increase the duration and intensity. When you start doing this exercise daily, you'll notice small but significant changes in the first few days. You'll feel that you urinate with more strength, that you empty your bladder more completely, and that you wake up fewer times during the night. This happens because the prostate starts to deflate as blood flow improves. Within a week of consistent practice, many men experience a clear reduction in urinary symptoms. It's not magic, it's pure physiology. When drainage improves, the gland decompresses and stops pressing on the urethra. The benefits also extend beyond urination. A stronger pelvic floor gives you better control during sexual activity. more sensitivity, and delayed ejaculation. That's why this exercise is a double ally. It supports both prostate health and intimate life. Many men make mistakes when doing this exercise that prevent them from seeing results. The most common mistake is contracting the wrong muscles, like the glutes or the abdomen, instead of focusing on the internal ones. Another mistake is tensing too hard, which causes fatigue and pain. Remember, the key is consistency, not excessive force. It's better to do gentle, regular repetitions than to strain so hard you can't keep up the routine. It's also a mistake to stop the exercise as soon as you feel better. The prostate needs continuous stimulation because aging and lifestyle continue to influence its size. So why does this exercise work so quickly? The reason Kegels produce results so fast is because they directly target pelvic congestion. When blood flow improves, prostate tissue gets more oxygen, fluids drain better, and inflammation subsides. In just 7 days of disciplined practice, men can notice less urinary urgency, fewer nighttime awakenings, and greater control during urination. While it's not a surgical reduction in prostate size, it's enough deflation to noticeably improve symptoms. Although this exercise alone is powerful, there are ways to enhance the results. Staying well hydrated, avoiding excess alcohol and caffeine, cutting down on heavily seasoned foods, and maintaining a healthy weight all help reduce prostate inflammation. Movement in general is essential. Walking daily, avoiding long periods of sitting, and doing additional pelvic stretches perfectly complement the Kegels. Another tip is to empty your bladder whenever you feel the need and avoid holding urine for long periods, as that increases pressure on the prostate. The prostate doesn't have to become a burden in your life. Many men go to the doctor believing their only options are lifelong medication or surgery, but the truth is that the body has natural mechanisms to regulate itself, and you can activate them with something as simple as exercising your pelvic muscles. What I'm sharing today isn't a secret. It's preventative and restorative medicine within everyone's reach. This exercise, which takes only a few minutes a day, has the power to transform your urinary health and intimate well-being. Don't put it off till tomorrow. Start today. Feel the changes, and within a week, you'll notice your prostate responding. I've personally seen dozens of men in my practice regain restful nights, confidence in their intimate life, and the joy of feeling in control of their bodies, all because they decided to do this simple but powerful exercise. Remember, the key is consistency. Make it part of your daily routine, and your prostate will thank you. Your quality of life will take a positive turn.